A breech pregnancy is when the baby is presenting bottom first in the birth canal. At 32 weeks, as many as 25% of all pregnancies will be breech. Jane Palmer discovered that her baby, Eloise, was in a breech position.
I just turned up for one of my routine checks and my midwife had a feel. And that meant actually that my baby was breech, and she really didn't worry about it at all. I was like, oh my god, breech. She said, yeah, but most babies are breech at some point, and you've got plenty of time, there's lots of room still for it to turn. And basically sent me home saying, don't worry about it.
As the weeks passed, and with the baby still not turning, Jane's hopes for a home birth were looking more remote.
Each time I went back, it was clear that she was still in the position that she was in. And come 37 weeks, I think, she said, right, we have to get you up to the hospital, and she basically handed it over, I suppose.
At this point, Jane joined the 4% of women whose babies are in breech position near full term, and for a natural vaginal birth to occur, this presents a number of difficulties for the medical staff.
The thing that most obstetricians would fear, which is extremely uncommon but very difficult to deal with, is that the baby coming bottom first delivers completely except for the head, and the head is held within the pelvis. And then it's very difficult to get that head out or to push the baby back inside in order to do a caesarean section. So that's the frightening thing about delivering a baby breech first.
As a result, the Royal College of Obstetricians and Gynecologists recommends that all breech babies at full term should be delivered by caesarean section. To minimise this outcome, women are offered a procedure called an external cephalic version, or ECV for short.
So the obstetrician, she checked again and she was still breech, and she said, okay, well, we could try doing an ECV, but we're not sure what the chances are of success. And she was quite alarmist about it. I mean, my own anxiety levels were upping anyway. And she was like, you do have to be prepared that if things, it could actually start things moving, going, and that you could end up in theatre the same day. And I didn't feel at all prepared at that point. I mean, it was 2.5 weeks before she was actually due.
Jane then underwent the ECV, where the obstetrician tries to physically manipulate the baby into its head-down position.
I remember looking down and watching the doctor's fingers just disappear into my pelvis. He really did go very deep, and it didn't hurt at the time and it didn't hurt afterwards. I felt nothing. He was very, there was a certain pressure, I suppose, but it wasn't painful at all. And there was this real sense of anticipation and kind of in the room. Would it work? Would it not? And it didn't. After all of that, it turned into kind of, well, you've got a breech baby that's not wanting to turn. So basically our route is to bring you in for an elective. That was the hospital kind of policy, procedure, whatever, and I was like, oh god, it was just the absolute antithesis of what I'd been hoping for.
Some don't like the idea of having their baby turned around into a position that it hasn't adopted itself. And for those women, we now recommend caesarean section, and this is on the basis of a large study done in many countries, pooling their results, which showed that for women trying to deliver their baby vaginally, if it was coming bottom first, the outcome was less good than if the baby was delivered by caesarean. And so that study has guided practice in the UK.
But for independent midwives like Andrea Prescott, the debate about breech birth versus caesarean is open to further discussion and more research, as there is a firm belief that if the baby is left untouched and the mother adapts a more natural position for birth, the outcome may be very different.
Breech delivery, which is a very managed breech birth with a woman lying on her back with her legs in stirrups and the doctor manoeuvring the baby out, as opposed to caesarean section. They found that the outcomes for the baby and mother were better if the woman had a caesarean section. This has been challenged a lot, and women are still consistently choosing breech birth, and breech birth as opposed to breech delivery is a very different thing again, because with a breech birth the woman is actually upright, you don't touch the baby's body, and one of the big reasons for not touching the baby's body in 99% of breech births is when you hold a baby or hold its waist, they do a Moro reflex, they do the startle reflex. If they're inside and they do a startle reflex, they fling their head back, and that's when you're going to really risk the head not birthing safely. So it's an interesting thing. No one has been able to produce studies about breech birth yet. Data is being collected and we shall see what the results are.
Jane went into labour the day after her attempted ECV and was rushed to theatre.
I was finally ready and they wheeled me down, they ran me down, we were running down corridors and I was in absolute agony. We arrived in the theatre and I was examined again and I was fully dilated. I was just ready to go, really.
Her baby Eloise was already well down in the birth canal, and for Jane the whole experience was quite frightening.
It was so unknown and so scary. I'd been catapulted into this mad medical delirium, really, which didn't mean anything to me. All I could feel was just their fear. I was so fearful of a natural breech birth at that point, which is, yes, there are risks, but there are risks with the caesarean and there are risks with all births. So, and I didn't come across anyone who said, look, let's have a go, at least.